Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got the top mistakes to avoid with oblique abdominal training if you have degenerative disc disease of the lower back or other lower back troubles. Hope you enjoy. So if you're like a lot of my patients with degenerative disc disease, you probably don't realize that your daily habits and postures and movements have a lot to do with the asymmetries and imbalances you have in your muscular system, including your abdominal obliques. And unfortunately, this can negatively impact your abdominal training, your core work, where you're trying to help prevent lower back irritation with degenerative discs and other problems by training your core and abs. But in reality, you're actually increasing the dysfunction and the stress on your discs. So let's go over this common problem. Many people don't realize that they have a tendency to twist to one side more than another during the day. They have a favorite habit in terms of crossing the legs, sitting to one side, looking over one shoulder, repeating that during their daily movements. As a result, the rib cage has a tendency to become stronger in twisting to one side than another. You can check that on yourself by keeping your hips straight and just turning your shoulders to one side and another side. And typically you're going to find that one side is going to feel a little looser or easier to turn to, and another side is going to be slightly restricted or more difficult to turn to. This highlights an asymmetry between your oblique muscles. Your external oblique muscles on one side of your abdomen run from your ribs down forward, and the internal oblique muscles on the other side run from your pelvis and up. And they work together as a unit to turn you, in this instance, to my left-hand side. If you're constantly turned to one side more than another, you're going to develop the strength and the tendency to turn that way. This, unfortunately, puts a degree of torque into the lower spine and irritates degenerative discs, facet problems, chronic instabilities, and any type of abdominal training. We need to keep these ideas in mind. We need to make sure that you're doing your exercises to strengthen proper function to help decrease the spinal stress and load on those discs, and not dysfunction like most exercise does if you don't understand what your body structure is. For a full understanding of your body structure, including tendencies to tilt, problems with multifidus muscles, internal oblique, external oblique muscles, I invite you to go to either the Pain Free and Fit website or the Posture Size website. We have a free body analysis there, and you can really learn about your unique posture and mechanical issues to figure out what you need to keep in mind when you're training. Otherwise, you're just going to be strengthening your dysfunctions. Concerning the abdominal obliques, if we have determined that we have a tendency to twist easier to one side than another, that side is our strong side, meaning the internal oblique muscle on that side is going to be more active, and the external oblique muscle on the other side is going to be more active, meaning they're going to be stronger. And conversely, the opposite obliques are going to be absolutely a little tighter. So what we want to do is we want to confirm this by seeing if our deepest core muscle, our transverse abdominis, when we contract it to stabilize our spine, if it's contracting normally or if this oblique is tensing on top of that. And what you do is you take your fingers to the front of your hip bones, the hardest points on your belt line, and move forward an inch or two and down an inch. That's your lower abdomen. It's underneath the line of your belly button. As you gently draw your abdomen in away from your fingers, normal function, that transverse abdominis muscle, the deepest of your abdominals, should pull in away from your fingers. And you should feel your skin and your abdominal musculature move away from your fingers. Many people, though, will have a tendency to have one side, as they try to draw their lower abdomen in, they'll have one side that tends to bulge out into their finger. And on that side, in that location under your belly button, that's indicating that the abdominal internal oblique muscle is contracting too much. So if I had a tendency to turn to the left more during the day, and that's my side that I feel I have a little freer motion compared to the other, chances are that internal abdominal oblique is going to contract more when I try to pull in my transverse abdominis. Now this is key to trying to protect your back while training and exercising, because if that internal oblique muscle is contracting when you hold your core muscles, meaning your transverse abdominis, in and contracting your other abs, you're going to have a tendency to overutilize that internal abdominal oblique, and there's going to be a slight torque or twist into that side. What that's doing is it's causing a rotational stress on the discs, on the joints, and irritating your lower back. So the fix to this problem before you train is number one, understanding square body structure. And again, if you go to that website, either Posture Size or Pain Free and Fit, you'll get the whole idea of, do I have a tendency to lean to one side, twist to one side, do I have weak multifidi muscles, do I have other issues with hip flexors or an anterior pelvis that prevents me from contracting my core muscles correctly. Once you have all that down, we have other videos, by the way, that describe that, as well as on the website. You need to practice contracting your transverse abdominis without your internal oblique participation. So you put your fingers back to that same area, the front of your pelvis, those two hard bony points on the front of your groin. Move in 1.5 inches, down 1.5 inches. You're beneath the belly button. And this time, as you draw your lower abdomen in, think about pulling the left side, if that was my hyperactive or over-tensing internal oblique, pulling that side in slower than the right side as you draw or suck in your lower abdomen. Slower and deeper. And as you practice slowing down the pull-in and drawing it in deeper towards your back on that side, you'll notice with practice you'll be able to get that correct inwards movement of your lower abdomen and avoid that internal oblique from popping out or moving forward or jutting forward into your finger. The more you practice this, the more you'll be able to include that in all your abdominal training. Now, once you've mastered this technique, you want to be able to do that and set that before you start your set or your reps of your abdominal training. And you always want to emphasize in your abdominal training, once you understand which side you're freer towards, is to limit the motion going that way by a slight bit, maybe 1/2 inch or 1/4 inch, but emphasize the movement moving the other way. This is going to help to rebalance the interplay between abdominal muscles, internal and external oblique. This is important also because it transmits force up to other muscles like the serratus anterior and latissimus, which have a tendency to attach to that external oblique fiber that comes up. And this is how things like tight lat muscles, where you can't raise your arm overhead or can't reach across to one side as much, how that muscle, because it also attaches to the lower back, can disturb lower back function. So keep these tips in mind. I hope it helps you with your abdominal training. If you enjoy this type of topic, please subscribe to our channel. We have a lot more of it. You can help me help others with degenerative disc and other lower back problems by giving me a thumbs up below, getting this information that's critical out to people that are exercising, that aren't sure how to work their own bodies with their own problems. And we have a lot more information on our websites. I invite you to look at it there. Hope this helps with your abdominal oblique training.